Greetings and welcome to this series where we are talking about the advocacy priorities set by the Non-Communicable Diseases Alliance in collaboration with the global NCD community to be presented at the 4th United Nations High-Level Meeting. My name is Ogweno Stephen. Let's roll. The first priority area that the global NCD Alliance has set together with the global community to be presented at the global United Nations High-Level Meeting in 2025 is accelerated implementation. Non-communicable diseases has been termed as a policy win, but an implementation failure. There has been some of the best policies developed in as far as the control and prevention of non-communicable diseases are concerned. However, on the flip side, we've seen that there hasn't been much done to implement these amazing policies that have been developed. And therefore, this is why the Global NCD Alliance is calling for the gathering at the United Nations High-Level Meeting in 2025 to adopt accelerated implementation. Some of the key advocacy messages that we are hoping to be adopted at this gathering is one, to really have a set deadline, or to have the governments to set deadlines for implementing the national NCD plans that have been developed. We want to see clear, trackable metrics being implemented and being followed through, and we also want to see accelerated implementation with set deadlines. Set deadlines bring a sense of urgency, but also ensure that there is accountability. The second thing we want to see is implementation of tried and tested interventions that are shown to provide effective, affordable, and measurable health impact in the communities. This includes implementation of comprehensive policies on unhealthy diets, tobacco use, alcohol use, and fossil fuels to ensure that populations are able to benefit from the implementation of these already developed pre-existing policies. Another action along these lines is the addressing social, economic, and political determinants of health. And this can be achieved by working across all sectors, ensuring that all key stakeholders are involved to ensure that we're able to really address these determinants of health, leading to healthier populations and leading to much more productive populations. Finally, I'd like to talk about ensuring affordability of healthcare services, ensuring accessibility of NCDs services, and also ensuring that the patient and the doctor's workforce or the medical workforce is empowered and ready to move into the communities implementing this very policy. When these drugs are available, when these services are available, when preventive health services are available, and when the health workforce is strengthened and empowered, we are deemed to see a reduction in the deaths and suffering caused by NCDs and an increase in health and productivity in the populations that these actions are implemented in. This forms the first key advocacy area that the Global NCD Alliance is proposing to be adopted at the United Nations High-Level Meeting 2025. My name is Ogweno Stephen, and I'll see you on the next one.